the calcium influx go inside and push this until it push the norepinephrine outside, and the norepinephrine would produce its effect, vasoconstriction. This group of medicine is called calcium channel blocker or calcium antagonists. They block here. It prevents the influx of the calcium inside here. So the norepinephrine never released. The impulse coming, and there is no response. No epinephrine is released, and no vasoconstriction will happen. This group of medicines called calcium channel blocker or calcium antagonists. Okay, this group of medicine, it has special suffix. Just when you listen to the suffix, you can, like beta blocker, if you hear the suffix lol, you see that this is beta blocker, right? But here for the calcium, these drugs work in here. This one here, it is amlodipine, or Norvasc. Amlodipine is a generic name. Norvasc is a brand name. Deltiazem or Cardizem. Felodipine, Blendil, Isradipine, Rhinocert, Nick, do you need anything? Nicardipine, or Cordine. Nifedipine, Adalat, Verapamil, Izopten, or Kellen. All these drugs, most of these drugs, it work with peen, okay? Amlodipine or Norvasc. Just this is Deltiazem or Cardizem. All this is a brand name, right? This is generic. Felodipine or Plendil. Isradipine or Dinacert.
All this is calcium.
Calcium channel blockers. It stops the calcium here and it prevents release of norepinephrine, and it helps to lower the blood pressure. Sometimes the calcium channel blocker by itself, it works by itself, or sometimes they give calcium channel with diuretics or with other stuff. It depends on the response of your blood pressure.
What's the last word? Isoptin?
Isoptin. Isoptin.
And what's this one? The treatment, isoptin and what? Calcium?
This is a calcium antagonist.
Yeah, it was diso. Yeah.
Sodium.
The one on top, the one on top. Before that. No, before. Yeah, that one.
Yeah.
Diazoxide. Hyperstat. It's called hyperstat. This group is called calcium antagonists. The other group is called ACE inhibitor here. And you know the story of ACE inhibitor, right? ACE inhibitor angiotensinogen, renin, angiotensin 1, and then converting enzyme, which is CE, right? CE, CE into angiotensin. 2, which is the troublemaker. Angiotensin 2, who is angiotensin 2 here?
Me. Who? Me. You? Yeah. Good luck.
Angiotensin 2, do you remember angiotensin 2?
Yes, yes.
What's wrong with angiotensin 2? It is strong what? Vasoconstrictors. And stimulate the suprarenal gland to produce aldosterone to reabsorb sodium. Right? Do you remember? This group of here, angiotensin ACE inhibitor, angiotensin converting enzyme, if we inhibit this, this is not going to be here, right? This group of drugs, angiotensin ACE inhibitor here, they inhibit the converting enzyme and prevent formation of angiotensin 2, and no vasoconstriction will happen. Is that clear?
Yes.
What are these group of medicine? Lisinopril and captopril. Lisinopril captopril. Lisinopril, captopril. These are called ACE inhibitors.
Could you put ACE professor there and I'm going to take a picture?
ACE inhibitor.
Yeah.
These are ACE.
Yes.
Uh-huh.
Therefore.
ACE inhibitor. Lisinopril and captopril. It prevents formation of angiotensin 2. So RAA system, it stopped. RAA system, renin, angiotensin, converting enzyme system is inhibited.
This is group
It's not
5,
working.
yes?
Group 5. Yes. This group here, angiotensin receptor, sometimes they leave this, they leave it. It works, okay? And the angiotensin 2 is released. And the angiotensin 2, it needs receptor to sit in and to produce its effect. They block these receptors. So angiotensin receptor here, angiotensin receptor. When it is released, they block the receptors. The receptors are blocked, so it's not working, doesn't work. This is called angiotensin receptor blocker, which are, this is a lot of medicine. Let me choose like 3 of them. 3 of them is important, is enough. Losartan or Cozar,
Also, I see the valsartan always this one.
I'm sorry,
Valsartan, I saw always in the prescription.
Valsartan, yes. Valsartan, which is,
Yeah, this one. This one.
okay. Okay. Here, Losartan, Candisartan, or Atacant. Iprosartan, Avipro, and more, just enough. This is enough. Sartan, all this is
One
angiotensin receptor blocker. I'm sorry.
ipracertan is
Candisartan.
the other
Candisartan.
one down. I
Iprosartan.
put the wrong.
Tebetan, name, generic name, you put wrong.
Avepro.
Iprosartan.
No,
Tebetan,
it's Tevetan, Tevetan.
Avipro.
Abracertan, this
You
is
will-
Tavertan, not Averpro.
Avitan.
Yeah, Teven.
Maybe we.
Professor. the last-
Avitan, okay. We have
Which one is?
generic name, one generic name, and we have one generic name, and for the brand name,
With
we
different,
have different companies
making the different.
producing the same medicine with different brand name. Okay? Different brand name. So you can find it in this way and this name also. But just the doctor choose the company, which company is having a better effect. This group here, and then this is a treatment of high blood hypertension. Sometimes when we have a condition called the hypertensive crisis, sometimes the blood pressure goes all of a sudden, high, all of a sudden. And it's dangerous, because when the blood pressure goes gradually, when the blood pressure elevates gradually, this is called the benign hypertension. But when it goes all of a sudden, this is dangerous, because it produces damage in vital organs like brain or heart.
Yes.
Okay? This is called hypertensive crisis. And this is a treatment of hypertensive crisis here. The azoxide or hyperstat and sodium nitroprusside or nitrite. Okay? This is for the treatment of high blood pressure. Is that important to reduce the body weight with the treatment of hypertension?
Yes.
Yes.
Is that treatment to stop smoking?
Yes.
Is that treatment to reduce sodium or salt in
Yes.
diet?
Yes.
Very good. Is that important to practice relaxation time?
Yes.
Is that important to exercise?
Yes.
Yes. all this, is that important to eliminate your mother-in-law?
No.
Yes.
Very
No
good.
headache.
Is that important to take the treatment regularly? Yes.
And professor, it's important to have 25 girlfriends, right?
Yeah.
And 25 mother-in-law.
Oh no.
No, this is troublemaker. I put them in two separate. This is troublemaker, this is something different. For the treatment of blood pressure, you have, maybe you have having a problem with the renin. Renin. Just the kidney secretes renin. And sometimes you have a problem with the hyperactivity of sympathetic nervous system. So sometimes you have different reasons for the essential hypertension. And that is why, no wonder why when the doctor gives you the medicine in the first place, sometimes it doesn't work. Why? Because he gives you antihypertensive medicine for certain system here. But the other, this is not the reason, the other system is the reason. So if it doesn't work, it changes to another system until he finds the right treatment of blood pressure for you. Is that clear?
Yes.
This treatment, this is the treatment of blood pressure, it goes into trial first. Trial. Usually now they try to give calcium channel blocker or ACE inhibitor. And they find this is the most common treatment now. ACE inhibitor or calcium channel blocker or combination. Sometimes combination between calcium channel and ACE inhibitor, also they add diuretics with this treatment until they get the desirable effect, and you just make it the permanent dose and go. Is that easy? Any treatment? Any question? No question?
Any treatment?
Any
Next
treatment?
week, maybe question.
Next week, question?
Patient
Maybe
education.
Okay. Okay.
Break time.
Break time.
Break time, break time.
Wow.
We'll see you in about
We're right there.